Good morning to everyone. My name is Eric Abe, and I sit on the board of directors of the Epilepsy Foundation of Hawaii. Um, it's my privilege today to introduce a fellow member of our board, Dr. Victoria Wong. Um, I wanted to give you some perspectives. I think of our board as if it was a movie, it would be the movie The Seventh Samurai. You have this ragtag group of experts in all of these different fields coming together trying to make the world a better place. And if the board is the seventh samurai, then Dr. Wong is the character Kyuzo. Kyuzo was the master samurai who was very quiet and soft spoken, but boy, you put a sword in that person's hand and they go nuts. They're a total expert. And that's what we think of Dr. Wong. I call her Doc, but basically she's the gun. She totally understands epilepsy and provides the clinical expertise that allows all of the other members of the board to really gain an understanding of the disease and its impacts on patients that allows the other members to better do the things that they do. You take a look at her CV and it's really impressive. She's a neurologist who specializes in epilepsy care and electroencephalography. She's the current medical director of epilepsy and neurophysiology at the Queen's Medical Center. She is an associate clinical professor in the Division of Neurology at the University of Hawaii Johnny Burns School of Medicine. She completed her medical school training at JABSOM and her neurology residency at the University of California, Davis, and her fellowship training at the University of Michigan. Um, in her spare time, she likes to play with her typewriter collection. Um, I just wanted to say that our board is extremely fortunate to have someone as experienced and knowledgeable as Dr. Wong on our board. And so it gives me great pride to ask that Dr. Wong um, take it away.
Thank you so much for that really nice introduction, Eric. I guess I'll have to go watch the Seven Samurai now. Yeah, so my screen is in full screen mode now. So hopefully everyone's able to see the full slide. So let's see if I can page forward. Yeah, so I do not have any relevant financial disclosures. And as Eric mentioned, I am on the board of directors of the Epilepsy Foundation of Hawaii. So today I'm going to be talking about seizure medications in combination. And I hope to answer three questions. First of all, how does your doctor choose which seizure medications to prescribe? And when do people with epilepsy need to be on multiple seizure medications? And what makes different combinations of seizure medications good or bad? So first of all, seizure medications, there are many, many seizure medications. This is a list, it's not even a complete list, but these are the ones that we prescribe for scheduled medications for the use of treating epilepsy. And you can see that the range goes from, barbital discovered in 1912, all the way to cenobamate, which is the most recently FDA approved medication for epilepsy. And you can see that 1990 was kind of a turning point after which the discovery and development of medications just exploded. And there were many medications that were FDA approved after that point or became available for our use in the US after that point. So choosing a seizure medication, how does your doctor choose which seizure medications to prescribe? There are many things we take into account, probably some that aren't even on this list, but these are the most common factors that we take into account. So first of all, we look at seizure and epilepsy type. So not all medications will work for all seizure types. Some seizure types can actually worsen with the wrong medication. One example of that is if somebody has absence seizures or myoclonic seizures, those can actually become worse if you use the wrong medication to treat them. We look at whether you have focal or generalized epilepsy, and there are some medications that are very specific to those epilepsy types. We look at the risk of birth defects. So if you're a woman of childbearing age and if you have plans to start a family, to become pregnant, or even if there's a risk of accidental pregnancy, there are going to be some medications that are safer than others to use. Some medications have a very high risk of birth defects, and so we try to stay away from those medications. We look at drug interactions. So if you take other medications, your seizure medication should not interact with them in a harmful way. I'll be talking more about drug interactions later, but one common example is hormonal birth control. So if you're on some form of hormonal birth control, if you take a seizure medication that makes that less effective, then of course that would be concerning. Or if you're prescribed an antibiotic and you're on a seizure medication that would make that antibiotic less effective, that would be an example of a concerning drug interaction. We look at comorbid medical conditions. So some seizure medications may need to be adjusted or avoided depending on what your other medical conditions are. Somebody who has a heart condition, if you have depression or anxiety, if there's problems with your liver or your kidneys, all of those scenarios require us to pay close attention to whether the seizure medication would make those conditions worse in some way. We look at medication compliance. So seizure medications, some of them only need to be dosed once a day, and some of them are very forgiving if you forget a dose. The medication stays in your system for a long time. Most seizure medications are dosed twice a day. Some seizure medications are dosed 3 times a day. And it becomes difficult for people to remember that midday dose sometimes. Seizure medications can come in extended release formulations. Some people have trouble swallowing pills, so medications come in liquid form. And then pill sizes also vary. So levetiracetam, Keppra being the brand name, is a medication we commonly prescribe for seizures, but those pills tend to be on the bigger side. So all of those things are associated with being compliant with taking medications, and sometimes we have to take that into account. We look at mechanism of action, and I'm going to talk a little bit about that later in more detail, but seizure medications work in different ways, and we pay attention to the way seizure meds work when we prescribe them. We look at possible side effects or allergic reactions. So seizure medications are in different classes as far as the way that they work. And some different classes are going to have different types of side effects or different propensities or associations with allergic reactions to the medication. So we have to pay attention to that. For example, if somebody's already drowsy all the time or has a propensity for dizziness, we would want to avoid seizure medications that could worsen those symptoms. And then lastly, insurance coverage, unfortunately, is something that we have to take into account. So depending on insurance, sometimes there are seizure medications, especially the newer ones that are only available brand name only. They're not available in generic form. Sometimes they may have a very high copay or they may not be covered. And we do have to think about that aspect also. So how many seizure medications does somebody have to be on? When we decide that, we always keep the ultimate goal in mind, which is no seizures, no side effects. Now, we're not always able to achieve that. Sometimes people have very severe epilepsy types, a lot of seizures, but we always aim for that goal of no seizures and no side effects. We usually prefer what we call monotherapy, which is just being on one single medication. So if somebody is just on one seizure medication and it has not been increased to like a high dose and they're still having seizures, we always want to optimize use of that one medication first. But if somebody tries 2 or 3 seizure medications and they're still having seizures, about 40% of patients will not be able to have their seizures controlled after trying a couple of medications. And in cases like that, we usually need to start discussing being on multiple medications. Sometimes even sooner than that, but depending on how you respond to different medications at different doses. So when we have to put people on more than one seizure medication, that's called polytherapy. And we usually prefer 2 medications, but in certain cases where people have extremely difficult to control epilepsy, very severe epilepsy types, they may have to be on 3 or 4 medications or more. It's different for every patient. So there's pros and cons of polytherapy, of being on more than one medication. So the pros are that seizure medications, they work in different ways. And so if you have 2 medications that work in different ways, you're kind of coming at the problem in 2 different directions. Sometimes medications can work in synergy, meaning that the combination of the 2 medications can be cooperative or better than each one in isolation. And it's actually true that they've shown by research that if somebody has difficult to control epilepsy, a combination of 2 medications can work better than just being on one medication. But there are downsides. So, sometimes there are more side effects because you're on 2 medications instead of one. We do pay attention to drug interactions. There are going to be more pills to take if you're on more than one medication, and it can be expensive for some people, paying for several copays. So what makes different combinations of medications good or bad? So spam musubi, good combination of spam and rice, or bad combination. I found this recipe for spam cupcakes, which does not necessarily make for a good combination. So we have to start with how seizure medications work before we talk about combining them. So as many of you know, a seizure is an electrical surge in the brain. Sometimes we call it an electrical storm in the brain. So normally there's an electrical balance among brain cells. So the way that your brain cells work is they all communicate with each other with electrical signals, and there's supposed to be a balance in that electrical signal. But sometimes when there's too much excitation, so too much of that electrical signal, or if there's too little inhibition, so inhibition meaning putting the brakes on that activity, a seizure can occur. So, we want it to look like the left side where the scales are balanced, but if there's too much excitatory electrical activity or too little inhibitory electrical activity, then you get this problem with the balance, and that's what causes a seizure. So this next slide is just a very complicated slide with the way medications work. This is a picture of how brain cells communicate with each other. A synapse is kind of the space between brain cells where a lot of that communication happens. And I want you to pay attention down here to the inhibitory and the excitatory synapse. So again, this is relating to this balance. And the way seizure medications work is different categories of different seizure medications. They just all work on different parts of the system to rebalance this electrical activity in the brain. So there's a lot of these different categories, and they just all work in different ways, and they all have different mechanisms at that cellular level. So what is good polytherapy? So using medications in combination, when is it good? So it's good when we use medications from different categories together. So going back to the slide, looking at the different groups of medications, it's good when you combine different groups of medications that work in different ways. And they also have different side effect profiles. So you're not kind of adding the same side effects on top of the same side effects. what is bad polytherapy? So when seizure medications from the same categories are used together, first of all, they work in similar ways. So you're basically kind of tackling that problem with medications that work similarly. So it's kind of redundant, and they may have overlapping side effects. So, if one medication has a tendency to make people drowsy and then you're on like a bunch of them, then that will make you extra drowsy. So there are certain combinations to avoid. So for example, this is a list of medications that we call sodium channel blockers, just based on how they work on that system. And so carbamazepine, oxcarbazepine, esclarcarbazepine, phenytoin, lamotrigine, these are medications that generally should not be used together. They're in the same class, they work similarly, and they all have very similar side effects. So when people have dizziness or double vision or balance problems, even one of these medications can cause those side effects, especially at higher doses. And when you add several of them together, then you are much more likely to get these side effects. There are always exceptions. So, for example, if you've tried one of them and you've been on them a long time and it's really working, and you've failed a bunch of other trials, or if you were in the hospital because you had seizures that wouldn't stop, and you needed to be on many medications, sometimes they are used in combination, but that's certainly not our first choice. So if you're curious about how your medications that you're taking work, you can always go to epilepsy.com, and there's a very nice section about seizures and epilepsy medications. And that section will have some details about how your specific medications work. Are drug interactions bad? The answer is sometimes. I mentioned earlier about some examples of bad drug interactions. So when you combine medications in general, not just seizure medications, but sometimes, and as Dr. Rosinski mentioned earlier, how they get metabolized in the liver, one drug can cause a second drug to have a lesser effect. It can actually make that drug less effective, or it can cause the second drug to have a greater effect. And sometimes that's bad too, because you can become toxic on that second drug, if you're not aware of those interactions. But sometimes those drug interactions actually work in our favor, and they're good drug interactions. And what I would say is, as long as you're aware of that drug interaction, and you can kind of pay attention to what the expected outcome is, then it's not necessarily a bad thing, as long as you're aware and that's discussed with your doctors. So what are some examples of, quote, good drug interactions? So, first of all, drug interactions have not been really researched at length. Nowadays that we have 20-something seizure medications, that literally means that even if you're just on 2 meds, that's literally hundreds of possible combinations. So, there's nobody that's going to go and research every single combination. But in general, we think that the combination of lamotrigine and valproic acid, probably, the sum is greater than the parts, especially in generalized epilepsy. There's one study that feels that the combination of lamotrigine and topiramate might be a good combination. And we're just learning now that maybe the combination of prescription cannabidiol, which is Epidiolex, and clobazam in combination may be a combination of medications that kind of have this cooperative effect. So how do you add on a second seizure medication? So obviously working with your doctor to do this, and being very clear about what the expectations are and what the side effects are. But you always want to make sure that first medication is optimized. If you're already having side effects on that first medication, or if you haven't really tried a higher dose of that first medication, you really don't want to be talking about adding on another medication yet. You want to make sure that you definitely want to be on that first medication and it's at a good dose and you're not having side effects. And then we always add on a second medication pretty gradually, so that if there is an interaction or a side effect that's concerning, then we can talk about making a change. You want to be prepared to reduce the dose of the first medication if needed, or of course taking away the second medication if there's any issues that come up. If that combination isn't working, you usually want to take away the less effective of the 2 medications. So sometimes people are pretty clear that, oh, the first medication worked really well, but the second medicine did nothing, or vice versa. So you want to be kind of hyper vigilant about, what medication is doing what. You want to try different medication combinations. If one combination isn't working, sometimes you will need a third medication. So, you have a first medicine that worked a little bit, the second medication provided a little bit of additional benefit, and you're not having side effects. So if you've optimized the first two, you may need a third medication. And you want to be really sure to follow instructions carefully, because anytime you're dealing with multiple seizure medications and kind of titrating up on the dose gradually, you want to, if your doctor gives you like a week by week schedule, you want to pay really close attention to what changes are needed. You want to make sure that you're looking at the pill sizes, because sometimes we use a smaller size pill to go up on the dose, and then we switch to a larger size pill, and you want to make sure that you're not confusing any of those changes or pill sizes. And so in summary, there are many seizure medication options, and you really want to work with your epileptologist or with your neurologist to pick the best seizure medication options for you. If taking one medication at a time doesn't help to control your seizures, you may need to be on a combination of medications called what we call polytherapy. And polytherapy really works best when this combination of medications is working for you and not against you. Okay. So thanks for listening. So I'm part of the Queens Medical Center Comprehensive Epilepsy Center. So the last couple of speakers, Dr. Stein, Dr. Ruzynski, and myself, we're at a level 4 accredited NAEC center, and this is our team, and I'm open to any questions. All right, so let me actually unminimize my screen if I can, and that way I can see the chat box and take questions. Okay, great. So it looks like the first question is if there's somebody who's on multiple medications, somebody's taking 5 medications, how is it possible to